Jay, obviously the words the President said 30 years ago have been picked over many times, but what about what he said just over a month ago, September 26th in Maryland? He had an event right before the actual rollout, and one of the things he said was, quote, if you already have health care, you don't have to do anything. You can at least say that was not true, right?
Look, I, as I said last week, accept that, communications are challenging here. The President, I mean, look, you have to remember that the Affordable Care Act promises.
Yes, it's not true.
Look, Ed, I've addressed this question repeatedly.
But
what I can
does not anticipate that cancellation letters would come out. I mean, you've been insurance companies are saying they kick people off all the time anyway. We knew that even before the Affordable Care Act kicked in. So how did that get in the President's remarks? Nobody here at the White House knew that, in fact, if you have health care, there could be changes?
What the President was referring to was the broader promise of the Affordable Care Act, that if you're on Medicare or Medicaid, if you, like probably most people in this room, have insurance through your employer, if you're a vet and you get coverage through the VA, you don't have to do anything. Now, and the proof of that, obviously, is that if you're uninsured, you now have available to you options to purchase insurance that you never had before. And if you don't qualify for Medicaid, but you might qualify for a subsidy, you have to look at your options and make your choices. But our focus, Ed, is on implementing the law and getting these benefits to the American people. And
But part of implementing it is communicating with the American people about if you have this plan or you have that plan, how you deal with it. And here's the President of the United States a few days before the actual launch saying something that just wasn't true, right?
Well, Ed, look, I accept, and I'm not going to argue with you that there's a lot of focus on a slice of 5% of the population, and part of that focus and the consternation that's been caused by the letters that have gone out is due to the failures of the website that have meant it's harder for these individuals to find out and be reassured by the fact that they have options for indisputably better coverage, and in many cases, most cases, coverage that's better for the same cost or less. So that's on us, and I accept that.
And when you keep saying this is only 5%.